Good morning.
Good morning.
You know, my memory is not usually that good, but I do remember how I started our talk in October. I can't believe it's been that long. But I started the discussion with hope and talking about what it was that we were going to see. And today, I want to ask you a question rather than provide that statement of hope. And my question is this: are you sure of what you hope for? Are you certain of what you don't see? That's going to be important as we move forward. And one thing that I love about the Republican women groups in Texas that I've visited is that you all have more fight than anybody else I've ever been to, any other meetings that I've been to. And so I appreciate that about y'all. It's one of the reasons why I'm a member here, and I will be bringing family members next month. So I am your neighbor as well. I don't live very far away. This is just an opportunity to go back and educate and to really establish what it is that we believe, and to fight for what it is that we believe. I think that's extremely important in this day and age. We are going to be bombarded like we've never been bombarded before, especially the case in healthcare. So what do we have to look forward to? Let me just give you a little bit of an update, and then as I did last time, I like to open it up to questions and answers, and give you the opportunity to ask questions so that we can talk about them and see how to move forward. There's already an effort. I don't know if you've seen it. It's quite a lengthy list of executive orders that will be overturned today. Many of them are healthcare related. I have not seen probably the one that I have been following the most closely of President Trump's executive orders is the pricing transparency. If you follow any of my work, I've been bombarding these hospitals with the fact that they're not compliant with the law. They'd rather pay the penalty than tell you what the truth is. And that'll be a wonderful opportunity to shame the administration if they overturn the fact that these organizations should provide pricing. That's the only way we're going to get to a free market. And that's incredibly important for bringing down the cost of healthcare and making it more affordable. So we're going to be looking at what will be overturned in terms of the executive orders. There is going to be a push for, because they control Congress at this point, we're going to see a lot of legislation that will be more and more steps forward to strengthen the ACA, to include a public option. They have said repeatedly that Medicare for All is not on the table because it was too progressive, but you know that they're lying when their lips are moving. So I fully expect that to be an option that will be put on the table, if not this year, then next year, depending on who the president is at that point. But those are the things that we have to look forward to. In Texas, thank goodness we live in Texas, right? And we've got some I tell you, we have some fighters there in the legislature as well that are willing to make the hard decisions and talk to the people of Texas as to what it is that they want, as opposed to listening to the special interests. And we're looking at introducing pricing transparency in the state of Texas, because regardless of whether it gets repealed or reversed in terms of that executive order, we're looking to make it law in the state of Texas, and that absolutely should be the case. We're also looking at making Medicaid better. We don't want to expand Medicaid. We want to improve it for the people for whom it was intended. So, the argument that people make is, David, why do you hate poor people? You'd be surprised. I get it all the time. But my response is, why do you want to increase the rolls and bring in able-bodied adults to crowd out the people that are the most vulnerable? Eligible women, children, the disabled, the elderly. That's what Medicaid was for. So we need to work on that messaging, and I'm happy to help anybody who would like to participate in those kinds of meetings where we understand healthcare at its most basic level, and then how to talk to people that would argue against us. So with that, I just really want to open it up to you all and see what questions you might have. They can be personal, they can be political, they can be state or federal. So do we have any questions in the audience? Don't Don't be shy. I'll tell you, hold your hand up. I'm just going to keep talking until I see a hand. I don't have a problem doing that, as you can tell. In the state of Texas, we've done a review of all of the hospitals in the entire country as to who is complying with these rules. Now, they have to on their website, list their cash prices and their negotiated rates with the insurance companies. Now, why is that important? Why would I care if I have insurance, right? Let me just give you an example as to why that's important, and then we'll talk about whether they're complying or not. If I'm a patient and I have an insurance that I'm a part of, say I have that, let's just throw them out there and pick on them today. And I have two hospitals that are in network and I need a CAT scan. One hospital is part of a big system and one hospital is just a single hospital, but they're both in network in my insurance. Because this one hospital is part of a big system, they're able to get better contracts. So maybe the CAT scan's $2,000. And these are not far from reality, by the way. And then the single hospital's negotiated rate with the insurance company is $1,000. Well, like most people in this country, my deductible is $6,000. So if I haven't met it, which most people don't ever meet their deductible, which one am I going to go to? If I know that this one gets paid $1,000, this one gets paid $2,000, I'm going to be responsible for those dollar amounts. Well, clearly, I'm going to go to the one that cost me $1,000, right? That's why price transparency is important. The mistake that the administration made was the amount of the penalty. The penalty was only $300 a day. For those of you that don't want to bring out their calculator, that's $109,500 a year for a hospital. Sometimes they make it out. They make that up in one surgery. So it's a minuscule penalty, and so there's really not an incentive for them to comply if the penalty is so low. And in fact, the American College of Healthcare Executives has encouraged the administrators to just pay the penalty and don't comply with the order. Pardon me, there's a fly right here. I feel like Mike Pence at the debate. So in Texas, what we've seen in our review of all these hospitals, only 24% of hospitals are complying with the order. 24%, 1 in 4. And in fact, I just saw this morning, Christus Health. This broke my heart because that's one of the first places I started working was the Sisters of Charity. They merged with Incarnate Word, this is back in the 90s, to become Christus Health. And they said that they were not going to comply because they didn't want to make known their pricing to their competitors. Yeah. Well, okay.
They want to make money.
That's the clear message, isn't it?
Yeah.
Shame on them.
Yeah. And they got lots of money too.
They got a few dollars.
Yeah.
And I'm sure they've done better from when I was there, and they were doing okay. That's why their nickname was the Sisters of Commerce. And they laughed at that too. I enjoyed the sisters. But it's varying from state to state. The best.
What about Resolute?
What's that?
Resolute, the other hospital in New Brunswick.
I have not. I need to look at that one specifically. I don't know off the top of my head. Right now, I'm looking at the broader numbers, and then we'll be drilling down. The worst state was Mississippi with 5% compliance. The best state was South Dakota, which is a surprise. Governor Nolan's just doing a wonderful job there. But we're going to be putting that out and doing some research and sharing that to show this lack of public trust that they're engendering with their communities, which most of them are nonprofits, and they're saying that they're there for their communities. Are they not? Well, not in this case. So that's more information I'll be happy to provide. And you'll see my face more often here. But you're also welcome to give me a call at any time. I'll leave some cards here. Any questions? Yes, sir.
I don't think you said the percentage that South Dakota. What is their compliance rate?
Theirs was 75% compliance.
Okay. And maybe you could explain the difference between a nonprofit hospital and charity hospital.
Well, it's nonprofit, we could get in the weeds in that. A nonprofit hospital, that's more of a tax status. I prefer to call them tax exempt because they make plenty of profit, if you look at their financials. A charity hospital may be more of a county hospital that just relies on the government dole to reimburse for the patients that come in. In Houston, which is where I'm from, the Harris County Hospital District, and I've gone to the county judges there, they just didn't want to hear it. 60% of the admissions were from undocumented folks. And all you have to do is demonstrate what your income is. Well, you don't even have to demonstrate. All you have to do is put 0 there, and you don't have an income, and so they'll provide you with free care. But they don't do an asset test either. So, you know, you could be sitting on a net worth that's pretty substantial, but not making income, and you know, you're welcome to get free care. It's a mess. So I hate to even call that charity because it's you know, charity is typically something that is done voluntarily by folks. Those are all tax dollars. That's hardly voluntary. So that's a charity hospital. Nonprofits they don't pay taxes, and so in exchange for not paying taxes, they are required under the law to provide a community benefit and give charity care. Well, they don't do that either. And what they end up doing, is everyone familiar with their list prices in a hospital? You ever seen those really, really big numbers that are scary? Okay, so this is how it works. We talked about a CAT scan. Let's just stay on that topic. The average charge for a CAT scan in a hospital is about $10,000. You know what the cash price is at certain places? $350. But if you go to a hospital that has a $10,000 charge for a CAT scan, and they say, you know what, you're eligible for a hardship, so we're just going to charge you $100 and give you charity care. Do you know how much they report that they've given in charity to the federal government?
$10,000.
$9,900. Did they really give that much charity? No, they really didn't, because based on the cash price, they probably gave a couple $100s in charity. But they're able to use that perverse system to benefit themselves financially in their Medicare cost report and the big payments they get at the end of the year. But unfortunately, even during the pandemic, these nonprofits, and I struggle to say that, these nonprofits have increased and escalated the number of lawsuits against people that don't have the money because they haven't paid their $100 bill. So they're taking them to small claims court. So that's why I'm so passionate about these prices being available and posted publicly for everyone to see. Not only is it good for having market-based forces, but it's just good for people to be able to make a decision for themselves and for their family. Yes, sir, you got your hand up.
You have 3 different pricing. You have cash price, the negotiated insurance price, and then you have the list price.
Correct.
All right, it's been my experience that the negotiated insurance price is less than the cash price. Is that, and I've experienced that, but is that more the exception than the rule? Or
It depends on the facility. So let me go through that explanation. So the big high dollar amount, that's the list price. The negotiated rate is something that you'll never see and they'll never tell you about. That's that rate that was decided between the insurer and the hospital. And then there's the cash rate. Now, depending on the hospital or the doctor or whatever it is that you're going to see, it could be higher, it could be lower than what the insurance negotiated rate is. My policy campaign, we have put out something called the shopping list on our website. And it's anybody who is just posting their prices transparently for the world to see in this country. And the majority of their prices are significantly lower than even the cash prices in the hospital or the negotiated rates. And if I may, I'll just tell a story. A gentleman that I ran against in Houston, we were congressional candidates, and he called me afterwards and he said, David, my son needs to have his ear tubes removed. I have a $5,000 deductible. The hospital fee alone in Houston is going to be $6,000. That doesn't include the doctor or the anesthesia or anything like that. So it would have been a few more $1,000 or maybe another $1,000. And I said, well, here are a couple of facilities, one in Austin and one in Tulsa, Oklahoma. And here are their websites. They post their prices. The one in Austin was a little bit higher than the one in Oklahoma, but the Oklahoma facility, which was a full bundled price for everything, doctor, anesthesia, facility, the whole shebang, $1,500.
Wow.
He was able to fly his whole family to Tulsa, which he got a good rate, so he flew to Tulsa. They stayed in a hotel, they got the procedure, had a great outcome, and came back well under $3,000. That is the future of where healthcare should be. That's what we should be doing. We should, if it's non-emergent and it's not catastrophic, which is 80% of what happens in healthcare, we should be able to shop for it like everything else in life. And if they tell you any different, get me involved in the conversation. I'd love to have the discussion with them. Did I see another hand up? Yes, ma'am.
Might be a little off topic, and I could afford to use some more education in the healthcare realm myself, but what's the long-term impact on HSAs, and where does that fall into all this?
HSAs are health savings accounts, and you're only eligible to have an HSA if you have a high deductible health plan, which a high deductible means $2,500. That's what a high deductible used to be 10 years ago. So pardon me, this flies here. It's very limited in what you can use it for. You can't use it for direct primary care. You can't use it to pay for your premiums. You can't use it for Christian sharing ministries. But you can for a massage or a chiropractor. It's just silly in how the law is currently applied. Thankfully, Senator Cruz is about to reintroduce the Personalized Healthcare Act, which talks about HSAs and broadens it and increases the amount of money that you can put towards it.
Wow.
So I actually was working with his healthcare staff this week, and we're just cleaning it up, and then we're going to be supporting it fully.
Okay, thank you.
Did I answer your question?
Yes.
Yes, ma'am.
As a senior citizen, I get Medicare and I pay a supplement. You pay the normal, most everybody I think pays the same. Your MD doctor said, okay, go get this test, go get the test. And then later on, you might get a bill from him because you haven't hit your deductible. I think it's $189, I don't remember. And then you get a bill because they don't cover the whole thing, you know, and that's what's really sad for senior citizens, because you don't know what you're gonna be charged later, and you're living on a budget kinda anyway.
Yeah, no, definitely. It's on a fixed income, so it's important that you know what you're getting yourself into. Some of the most expensive words in healthcare are go get that test down the hall. Because the doctors probably they have an arrangement, or they're employed by the hospital. Just because they're telling you to do that doesn't mean that you can't say, is there another option that I can go to? Is there somewhere else that can be a more affordable option where I don't have to be exposed?
It's just sad because a lot of people don't know. You're listening to that doctor, and then you go do it, and then you get a bill for $500 because they don't cover that much of what they're.
And typically people's response will be, well, you have insurance. Insurance will take care of it.
No, it doesn't.
That's just not the case anymore.
You think you're paying your Medicare, and then you get that supplement that's gonna pick up what it didn't carry, and that's.
Right. And sometimes that's a fight.
Yes.
No, I'm well aware. I've been in that world too. I used to be, as I mentioned earlier, I used to be in the hospital industry as a hospital CEO for nearly 20 years. And it's gotten worse and worse and worse for patients, which is one of the big reasons why I'm here and not there.
I have a question.
Yes, ma'am.
So I had an MRI in August for my foot because I have this swelling on my ankle.
Okay.
And I had melanoma in that leg. So the doctor said, you know what, I'm concerned, let's have an MRI.
Okay.
So I had an MRI of the ankle, and then they did the foot because the swelling was going into the inside of the foot. Okay, so I had it, and then I get my explanation of benefits, $3,000 that no one's covering. And the reason they said they didn't cover, because I called the insurance company and I said, why are you not covering this? They said, well, it's pre-existing. said, no. See, I had plantar fasciitis.
Okay.
Okay, on the bottom of my foot, but this is my ankle, right?
Right.
So when
It's your foot though.
I know, they don't care if I have a foot. So what happened is the imaging company, when they sent in the report, whatever the codings are, they said it was for plantar fasciitis. But that's not what the doctor, her codes were not plantar fasciitis. So then I had to go back to Strict to have them change the codes, to resubmit. That didn't work at all. It was
never
like,
works.
it never works. Then I had to go to the doctor had to write a letter. I had to send all this information. I had to write this very long letter to fight this. And I still haven't heard anything. So, $3,000 I expect might be, even though we explained that yes, I had plantar fasciitis, that's not why I went. Although the results on the MRI results, because they saw everything, they said, of course, I had plantar fasciitis, so that's what they stuck on, because it was pre-existing.
So, I'm sorry.
Me too.
The one thing that I would advise you to do is to call the folks that did the MRI and ask them what their policy is. You don't want them to send you to collections or to disparage your credit.
Yeah, they're well
If you have any issues with that, please let me know. I'm happy to help. Also, you can, if it is not paid, you can certainly negotiate. But the appeal process is just.
Bullshit.
Thank you. I'm in the presence of ladies, so I want to say it myself.
Did you happen to see that itemized childbirth bill that mother posted where she was charged for skin to skin time?
For what? Oh my God.
I would love to see
I don't
that.
know what state it was. I'm pretty confident it was not Texas.
Do you still
but there
have
was-
access to it?
I might. I'll search.
I'd love to see that.
She looked at her itemized childbirth bill and it said skin to
Yeah,
skin time. There
your
was
child
like
lays
a
on your
$250
chest and they'll charge you
for
for
a
it.
nurse to place your naked child from the womb to your chest. What? Yeah.
Well, and I don't necessarily blame the hospital for that 100% because the government established a code for it.
That's insane.
So, in a sense, the hospitals are being good fiduciaries and billing for everything that is available to them. 80% of the problem is the government creating this environment that is just so bad for the people that they say that they want to help.
Democrats.
Well, let me go to this young lady back here and then we'll come back.
Change the subject just a little bit, but.
Oh, no.
Do you have any insight on the status of the vaccine being available in this state?
Texas has vaccinated more people than any other state in the country.
HEB doesn't have any of that.
Right, well, for some reason, we're being punished, in a sense, because they have limited the supply of vaccines coming into the state because we've done such a good job of delivering it and getting it in people's arms.
Well, I heard California was putting it on pause.
Well, in New York is actually,
California.
New York has actually
Because they gotta put the
wasted
chip on it.
vaccines because they didn't store them at the negative 70 degrees necessary. Let's reward that behavior and not get it to a state that's doing it well.
I thought it was
So that's,
CVS and Walgreens.
I hate to be sassy about it, but that's just my normal state.
I figure all you guys are gonna get vaccinated. I don't
I
have
fit
to.
in well here, don't I? Did that answer your question, ma'am?
Yes, I guess.
I think she has
Can I add something to that?
Certainly.
There is a policy, at least in Texas, and I don't know if it's nationwide, but you do not have to live in, be a resident of the county that you go get vaccinated in. So if you live in Comal County and Bear County has a surplus, you can go to Bear County, just make
That's
an
right.
appointment or find, and there's a list on, I think the state, Health and Human Services website, a link of what, they've got like super hubs around the state, and there's not very many of them, but there are, I think Comal County has applied, and another hospital in Gillespie has applied as well to try, because they don't have any vaccines in Gillespie or in Kendall County as well, but go on the website, there should be a link for, locations for the vaccines for hubs. And you do not have to live in Bear County, or if you go to Austin, because they have the super hubs there as well. So you can go either place that has vaccines to get one.
And Bear County has done a really good job. They've opened up the Alamo Dome to conduct vaccines. They've gotten very efficient at it. I think they've probably done the best job from the last I've heard about them. But I think that was my time. I was told I'd have a couple hours.
Ah.
If it was a day